I have to say that this is one of those bipartisan things that bring people together instead of bring them apart, and that allows us to get things done when it comes to like funding of NIH and the improvements that we've seen there. Not as much as we want, but still nearly every single year we're seeing funding increase after funding increase. And so there's not a lot we agree around here, maybe like a volleyball resolution. So, this is good. And my co-chair and friend, Senator Wicker, of course, Congressman Matsui, Congressman Bilirakis, who I know you heard from, and then Dennis, thank you, and Erica, and Amy, thank you. Sorry to cut off your remarks. The chart looks super good, and I'm sorry. I did pick up a little information there, and thank you to the team at the Every Life Foundation for Rare Diseases for organizing this briefing. My state is truly in the epicenter of this because we have so much good medicine going on. We're a state where, the women are strong, the men are good looking, and all of the medical research on rare disease is above average. So I want to just let you know that for me, this is a state issue, yes, but it's really also a national issue. Today and throughout Newborn Screening Awareness Month, we're focused on ensuring that every baby, no matter where they're born, gets the most comprehensive newborn screenings possible, that moms get those screenings. Newborn screening is one of the most successful, cost-effective public health programs in the country. We know that 70% of rare conditions start in early childhood, and screening can identify a condition before it becomes observable to patients or clinicians. I had a little brush with this in my own life that really got me involved in rare disease a bit, but also just policy about births and what happens after kids are born. They had that rule that you were kicked out after 24 hours. When our daughter was born, she was really sick. She couldn't swallow. Everything she swallowed came out her nose. They did a genetic thing. They could not figure it out, but it actually having those screenings ruled out a whole bunch of things for the first year. We eventually put her on a stomach tube, which many rare disease patients and families know what I'm talking about. And then after about 2 years, she somehow miraculously, because when she started to eat, even though she was in the bottom 1% for a year, it improved. And we didn't do things that we could have done that would have been bad for her, just because we were able to use the screenings available at the time to rule out a bunch of things. And we had conflicting medical things. I ended up with a doctor in Atlanta named Dr. Risky. That was a great one. And I went to the NIH with the problem. I was just a mom. I wasn't elected. And I was just sending these letters with these swallowing studies, which I think people can relate to. But those screenings and the doctors and the help we got made it easier for us, even not maybe having a rare disease. To this day, they think it was something that was wrong, that then led to these allergies and things. Maybe one day they'll figure it out. It just, she just graduated from law school, so what can I say? So the story has a good end, but it was really made me aware of parents with kids with a lot bigger problems than she had, because she was in the ICU for a number of weeks because she kept losing weight. And I got to see those parents and what they went through, and I got to see them with their kids. I got on a board of parents with kids with disabilities, Pacer Center in Minnesota. It's pretty well known. And I did a lot of work with them as I was the DA and things like that. But it just gave me a more ground level view of this and how frustrating this is, when the research money isn't there or when clinical trials are stopped, and how we have to be on top of this in a big, big way. In my state, we offer one of the most comprehensive newborn screening programs in the country. And I think we should have that happen in every single state, because we all know that early detection and diagnosis can be the difference between a child being subject to years of unnecessary tests, searching for answers, and getting the evidence-based care that they need. That's why we are working the group I just mentioned of members of Congress to simplify kids with rare diseases abilities, their families' ability to be treated without delay by a Medicaid provider outside of their home state. my story, right? Dr. Risky, because kids with rare conditions shouldn't have to wait to get the care that they need. I'm also working to ensure that kids with rare diseases can access molecular diagnostic testing at their initial diagnosis, because having access to these powerful tools differently or immediately is going to make a huge difference. I'm actually really excited about the potential for AI with rare diseases, and we have to have guardrails on AI. Believe me, I have a bunch of those bills. Senator Thune and I kind of have a base bill involving healthcare that just got through the committee. But that being said, especially with healthcare and figuring out these rare diseases diagnostically as well as treatment-wise is going to make a big difference. So that also gives me some hope. As I mentioned, we keep getting a boost for NIH and the Defense Department's medical research program. We know that every federal dollar we put into research today paves the way for cures, with every dollar of NIH funding creating $2.64 of economic activity. I believe in this so much. Then when we had our government shutdown years back, everyone was giving their salary to something, a charity, whatever. I gave mine to NIH to make the case that these trials were being suspended and that our messing around and all the dysfunction was actually affecting kids with rare diseases. So I'll end with this, because I think it's always good to remember the words of people that struggle with this every day and that actually come out of it as some of the strongest people I know. People like Abby Hauser, young woman from my home state. She's one of the 30 million Americans living with one of 10,000 known rare diseases. I got to know her through her patient advocacy, and I saw her in Washington many times as well as at home with Every Life's Rare Disease Week. Since she was a little girl, Abby has lived with a condition that causes chronic pain, frequent bruising, and other symptoms, but it hasn't stopped her from thriving. Among other things, she's a board member, a champion for inclusivity in sports, and even a marathon runner. And after finishing the Chicago Marathon, she said this: "I hope anyone who sees me run sees a world of capabilities the next time they see a person with a disability. Everyone has a right to chase their dreams, no matter the size or how it's accomplished. All it takes is some relentless forward progress and the guts to dare greatly." The guts to dare greatly. I think we need a little bit more of that in this building. And so please continue your advocacy and continue the work. Listen to this great panel. Look at the charts that I've so rudely disrupted. And just use those facts, but don't remember also the passion for getting it done. It makes a difference. Thank you.